Okay, so let me have your heart over there. I like yours better. I know you don't have a good heart.
I was going to say, I was
Good
having a
heart.
problem.
Oh, no, you're fine. Thank you.
Two hearts are better than one anyway.
Once again.
Yes. Yes, yes.
Like it.
Finally, we're getting to the heart of the matter.
Yeah, come closer and
I
then you
didn't do
can
that.
send it to me if you will.
Okay, so a couple things to do. First is get oriented. Where's Amber at? Okay. All right. First thing is get oriented. All right. You get. Okay. So in my chest it sits like this. In your chest it's going to be like that, and that. Okay. And so now we know this is anterior, and this is posterior. Generally, the posterior is going to be flatter than the anterior if you're trying to get oriented. Okay. So we can kind of use that as a rule right now. So with this anatomical position, we've got down here apex. Okay. We also have here, all this that I'm touching here is the base. Okay. So name this area of the heart that I could ask. Okay. That is all the base. So now with some exterior features here, we can appreciate a groove on the anterior interventricular groove, right? And then sometimes I have to make them, but there's a posterior interventricular groove as well, all right? And with those things identified, we can even begin to say, name this superior or superficial layer of the heart, which is the epicardium, nice shiny layer. You can even see a little bit, as you kind of see the brown stuff, that's going to be myocardium that I'll get to in just a second, okay? We can also, though, appreciate our chambers, okay? All this that I'm touching here is the right atrium, okay? And the left atrium is all of this. Now they're a little bit smaller in the animal than they are in the human, but they're still here. So they're the right atrium, left atrium here. Right ventricle is all of this, okay? Left ventricle is all of this. All right. So with our right atrium and any atrium for that matter, you can appreciate little ear-like appendages. Okay, and there's the left auricle. Name that ear-like appendage. That's what I'll say, just to help you out a little bit. Okay, ear auricle refers to ear, so I can say name that ear-like appendage. Same thing over here, though it's been kind of damaged. But with the right atrium, I can open it up, especially here, and we can even see to some degree here some pectinate muscles. They're damaged a bit, but they're still here. Okay, those are pectinate. I'll show them in the right atrium, even though they do show up in the left atrium to some degree, but I'll show them in the right primarily. Okay, so now we can go down here to our right ventricle and open it up, and we can see, again, myocardium, very, very thick, not as thick as the left, but still thick. We can appreciate here the papillary muscle with the associated chordae tendineae. Okay, and I always show a papillary muscle with attached chordae tendineae. Okay, and then attached up here is our valve, which is the tricuspid valve in this case. All right. All of that. So name that structure, okay, that connective tissue structure, that is going to be the tricuspid valve. All right, so papillary, chordae tendineae, and then the valve. We can also appreciate maybe, we'll appreciate that later. All right, so let's go over here to the left ventricle. Very, very thick myocardium, as you can see, right? You can also, though, see a shiny lining of the heart, which is the endocardium, okay? Gigantic papillary with the chordae tendineae, and then all of this connective tissue here, that is the mitral or bicuspid valve. Okay. Now, if we kind of remove some of this endocardium, underneath it, you can see some bundles of muscle kind of oriented in a crisscross arrangement. All that is trabeculae carneae. Okay. Both ventricles, but here I've shown it in the left. I can show you either one. All right. So it takes care of our valves, at least some of them anyway. And now we have a couple of vessels to identify. And this vessel right here in the anterior, this is the pulmonary trunk, okay? And we also have here behind it, posterior to it, is the aorta. That's always going to be the case. Pulmonary trunk, anterior, aorta is behind it. Very, very thick-walled aorta, all right? So now if we open up pulmonary trunk, I need your assistance here. If we open this up a little bit, okay? And now I can go ahead and grab, okay, the little cusps that make up the pulmonary valve or pulmonic valve. Notice they're semilunar shape, okay? So hence the name, it's being a semilunar valve. So this is, name this structure, pulmonary valve or pulmonic valve, whatever you want, okay? That's that. Our other vessel here, though, is going to be the aorta. Now, I can't show necessarily with ease the aortic valve, but you look down in there and you can see it, okay? Aortic valve is down there, way down in there, okay? And so I could use the model, or I could use this if I wanted, but, you know, either way, it's down in there. A couple other vessels here that we want to be able to at least identify is this one here, which is what's left of the superior vena cava as it dumps into the right atrium. So name that opening or name that vessel, name that structure, okay, still SVC.
Does the inferior vena cava attach to it up here and then dump, or does it?
No, the IVC is over here. Now, depending on what you've got here, okay, this is your IVC, okay, right there. See, if I put my probe through there, I'm end up in the right atrium.
Oh, they
Okay?
both have their own entrance.
They do.
Okay.
Yes, they do. Yep. Very good. Good question. Yep. So IVC is down here. It's not a great one. I probably wouldn't use this, but there you can see that. Okay, there's IVC, and those are perfectly acceptable abbreviations. Name that structure, name that opening, SVC, IVC. Okay, and you'll see where my probe is headed. Okay, and you're welcome to ask me, hey, can you put your probe through there, and you can see where it's going. You know, you won't get to touch this, but I'll certainly make sure you can see where the probe is going. So then you know if it's going to right atrium, 50-50 pretty much. You know? All right, so that takes care of the SVC and the IVC. And now we have openings for pulmonary veins, and this is our left atrium, and so these are gone here, but the opening is still here. Okay, name that opening. You can see it's going to be openings for pulmonary veins. Again, these are animal hearts, and people take them out, don't always save the vessels, but they're there. Okay. One last thing I want to show you on this specimen is that you've got a groove between the two, right? Coronary between the two upper chambers and lower chambers. Coronary sulcus or coronary groove, whichever one you want. Okay, best shown in the posterior, but it does make its way around the front, and I'll show it best where you can see it. Okay, I think that does everything on here. And kind of a shotgun approach on your handout, but I think that does it. And I don't have a model here for the blood vessels, but you want to get one because on the model you can see all the coronary vessels we have an interest in. You can also see if you pull off the right atrium, open that up, they all open up. You'll see on the wall there, on the septum, intraatrial septum, you'll see the fossa ovalis. Okay, you also see some pectinate if you flip that atrium open too, so you'll be able to see those. It'll also show on the models the pulmonary arteries right and left. I don't have them here because they've been lopped off, but you have those two.
Okay.
Okay, I'll be back in about 30 minutes, and you guys can show me.
When we have
You'll show me two over here.
our lab exam, is it going to be a bunch of hearts with pins in it?
No. You'll come up to my kind of table up there
Individually?
as a group of 3 or 4 or 5 maybe, and I'll say just like this, name that your like appendage.
Okay.
Okay. And you can say, can you tilt it a little bit and turn it? I'm happy to do that, but that's pretty much it.
Okay.
And nothing else. But again, you'll be able to see clearly. I'm not going to hide it from you. So,
Okay.
Get familiar with looking at a heart from an anatomical position.
Yeah.
Okay. Because if you get right and left screwed up, and you have to know right atrium, left atrium. For that, you can't just put down atrium. So one other thing I want to say is, if I'm asking you to identify a chamber, all right, I'll say name the location of my probe. In that case, I'm in some type of space or some type of cavity, and our cavities here are the chambers. So if my probe is in there, name the location of it, right atrium, left atrium, whatever it is. That means I'm inside some type of space. Okay.
Also, do you have lab files or just lecture files online? Do you post both? Or?
Lab files, what do you mean by that?
Like your
Like-
slides